Hi everyone, this is Dr Eyetemou Miguel, once again your pharmacist, and in this new video we are going to talk about a very important theme. We're going to talk about a disease that affects millions of people over the world. That's diabetes, and we are going to see 9 major complications of diabetes and 5 ways to prevent those complications. When we talk about diabetes, it refers to high blood glucose levels, and this high blood glucose in the body, in the blood, is going to damage your blood vessels, and it's from these damages on the blood vessels that you are going to have the complications or other health issues that might rise linked to that damages on the blood vessels following the diabetes, the high blood glucose levels. So as long-term complications, we have diabetic retinopathy, which is a disease that touches or that impairs the eyes functioning, and this might lead after some time to sight loss. Very dangerous. Number 2, you have food problems that diabetes can cause. You will have loss of feeling in the foot. You will have wounds that will be slow to heal, and that might lead to amputation, to losing your lower members, losing your foot. Number 3, you have diabetic neuropathy, which is a condition that affects your nerves, and you are going to have some physiological functions that will be impaired, such as seeing, hearing, and moving because of these nerve issues. Number 4, you have heart health issues that will arise out of diabetes, long-term or chronic high blood glucose levels, such as stroke and heart attack. Number 5, you have mouth problems because the fact that there will be too much glucose in your saliva will make the bacteria in your saliva to produce more lactic acid, and that will destroy your enamel and your gum. Number 6, you have your cancer risk, which is going to be increased. We all know that cancer cells feed on sugar, so they feed on sugar. So when you have a lot of sugar in the body, that will increase your risk of developing cancer over time. Number 7, you have diabetic nephropathy, which will affect the kidneys. We all know that the kidneys are organs responsible for clearing the waste or eliminating the waste out of the body. So with diabetic nephropathy, that might lead to waste accumulation in the body, and that might also lead to kidney failure. Number 8, you have urinary tract infections, which are going to be more common in women. And number 9, you have sexual problems more common in men, such as erectile dysfunction. Now, 5 ways to prevent those complications. First tip is to manage your diabetes well. So if you have been put on medication, take your medications according to the prescription of your physician, and also go to each of your appointments with your physician. Number 2, you have to keep moving, to keep active. Physical exercise will improve not only your diabetes situation, not only prevent those diabetic complications, but also improve your stress, improve your immunity, improve your sleeping patterns. Number 3, stop smoking. Very important, because tobacco itself is going to damage your blood vessels, to damage your heart, and that's not going to be good, because diabetes is already damaging your blood vessels. Number 4, you have to eat healthily, to have a diet low in sugar, low in fat, low in salt, and to eat more plant-based foods, more fruits, more vegetables that are going to improve your overall health. And number 5, you have to take care of your feet. I've seen that diabetes leads to foot problems, so you have to really have a good foot hygiene to avoid wounds that might become so difficult to heal that it might lead to amputation.